trials. At just 20 years of age, Briana received the devastating news that she had cancer. Although she did beat the odds and is now cancer-free, the scars from her battle still haunt her.
About 7 years ago, I started to notice a blister in my gum area. As the months went on, it got bigger and bigger, like a tennis ball. The tumor got so big, it was pushing down the left side of my teeth, and it started to cause me a lot of pain. That's when I decided that I needed to go to the emergency room. They brought in an oncologist. That's when they got the results back. This is cancer. They split my face halfway. My top 7 teeth were removed. They removed the entire tumor and also the bone that was above it. But then about 2 years after, it did end up coming back. On one side, I feel like I have a normal person's face, and then on this side, I look like a skeleton. This stopped my entire life. This eye is pretty much completely useless because my line of vision is just completely different. I only can eat on one side. I'm always covering my mouth and trying not to show that I don't have teeth. I feel so uncomfortable and so just awkward. I don't know how to speak to people. Why am I here? Life is love, life is happiness. If I'm so sick, why? I feel like I don't have a chance.
Briana's scars went beyond skin deep, so we sent her to meet with Dr. Judy Ho.
Briana walked in looking defeated already, like life has already beat her.
I don't know how to be happy anymore, but I see the bigger picture of my life and what it could be, but I just don't know how to get there.
I know you went through cancer. I mean, it's amazing that you've survived that, and at such a young age. How old were you when you were diagnosed?
Almost 21. I just kind of got stuck in that medical bubble. It felt like I lost my youth.
It sort of became your new identity, sort of being a sick person.
And I was also overweight at the time. That's when my depression, anxiety really started to get worse. I just felt like such an outcast.
I think you know intellectually a scar on your face doesn't prevent you from reaching your goals.
Yes.
But your emotions...
I can't help it. I can physically leave my house, I can walk and talk and breathe, but I can't do anything that's gonna put me in an uncomfortable situation. I literally feel like a prisoner, trapped in my mind.
Briana said multiple times that she felt like she was trapped in her own mind.
I feel trapped. I just feel trapped.
How has your family dealt with this?
It's been hard. They don't understand that when I say I can't do something, I physically or mentally can't. Also, just feel like I don't want to be like the wet blanket. That's what I call myself, because I'm never happy. So why would you want to spend time with someone else?
Briana, you've been depressed for such a long time now. You know, it's been, I guess, over 3 years.
I see all the people and all the bad stuff that happens in our world, and I look at these people and they just look like they have these like amazing lives, and I just feel guilty because I'm like, I'm sitting here not worth anything, and you know, people are losing their lives, like why not me?
It's just remarkable that she can go from, I have this scar on my face, all the way to, why do I deserve to live when other people are dying every single day? That thought process took her less than 10 seconds to get to. One positive thing, though, is it sounds like your medical issues are under control. So, and you've been on that route with your weight loss.
I lost over 150 pounds.
Wow, that's great.
That's the one thing I could control. At least I can be making my body healthier.
I think you said something really important, which is the sense of control. And that is different from get a job to have a relationship. That's not all just within my control. And that's the kind of thing that scares you the most, and that's when your thoughts really take off. The biggest inhibitor to her living a full and meaningful life is all of the thoughts that attack her on a daily basis. And we know how dangerous Briana's thoughts are.
Briana joins us now, and Briana, before we get into the physical, I want to touch upon some of the things you were talking about with Dr. Ho. And did meeting with her help you understand some of the thoughts that you were having?
Definitely. It's just, I'm very confused. Sometimes I don't really know how, because I feel like the happiness inside of me, but just being, all the things I've been through just has made me so sad. And I just didn't really know like where to talk or who to talk to.
But you know what? I'm proud of you. You're here today, despite social anxiety, in front of all these people, and there is so much hope. To address a lot of these self-esteem issues, we actually did reach out to therapist Tara Cameron of Collaborative Counseling of Kingwood. She's going to see you for the next 6 months free of charge. Because there is a lot I want you to work with her on. But having said all that, you've done so much hard work. You're so much healthier. You are cancer-free. And yet, having said that, you acknowledge when you look in the mirror, you have a constant reminder. So I want to bring into the conversation dentist Dr. Karash Madahi, who met with Briana before the show. Doc, what did you find?
In Briana's case, some of the challenging aspects of it is that there's so much bone loss due to the surgery. And there's also 7 teeth missing on the upper left. And the entire sinus has been taken out. A lot of tissue grafting has been done. So it's not just a matter of putting a denture or a partial or implant. None of those things really work for her. It's creating a prosthesis where she can also get some of the deformity of the face taken care of. So everything that's underneath the cheekbone that's gone in is all due to the loss of bone and loss of the teeth. And the good news is I've talked to my lab technician and we are designing a custom-made prosthesis for her. Not only so to not only get her smile back, also be able to chew, and also more importantly get that facial symmetry back. And definitely, Briana, I guarantee that's what's going to happen for you.
And Briana, I also want to bring into the conversation plastic surgeon Dr. Bob Basu, who's Skyping in from Houston, Texas. And Doc, you have something you'd also like to share with Briana.
Briana, I've had a chance to look at your history and look at some of your photos, and I have good news for you. The first thing that comes to mind as a great option for you would be fat micrografting, essentially taking fat from somewhere else on your body and transferring that fat into areas that have experienced volume loss. Now, the one thing in your history that you have is, my understanding is that you've had radiation therapy. And if the skin's not healthy enough, Briana, for fat transfer, we may have to talk to you about a little bit more of a complex procedure called a free tissue transfer, where we're taking tissue from somewhere else on the body and actually transplanting that tissue into the cheek area so we can volumize that area. You've got some options, and we really look forward to seeing you when you're back in Houston, our office, so we can help you with your journey to restoration.
I'm nervous, like, being here, but I'm just excited and just looking forward to, like, possibilities of changing my life.
Well, I have high hopes for you, and I cannot wait to potentially have you back on this stage and see you smiling and happy, not because of the physical results you're going to get from these docs who graciously offered their services free of charge to you, but because from inside, emotionally, you're going to be in a better place because you're a wonderful person and you deserve this.